everyone! For today, I will be demonstrating how to perform vital signs for an elderly individual. So, before we start doing the procedure, we should know that there are 4 parameters in taking vital sign. First parameter will be the temperature by using our thermometer. Second one will be the pulse rate by taking the pulse on the radial pulse. Then third one will be the respiratory rate by checking the breathing pattern of the patient. Then fourth one will be the taking the blood pressure. So before we do any aseptic task, we should always perform hand hygiene. But before we do the hand hygiene, when we enter a room, we should knock at the door, then introduce ourselves, then identify the patient using the name of the patient and the date of birth. If there is a medical record number, we can use also the medical record number for the patient in identification of the patient. Okay? Especially if the patient is a bedridden. So, first thing we have to do now is knock on the door. Then, when we knock, let's do the hand hygiene. Okay? First, do the hand hygiene. After doing the hand hygiene, we can proceed to talk to the patient. If the patient is not talking because she's bedridden for a long time already, a basic, and doesn't understand whatever we are saying, it's incoherent, we can check the name on the wrist. Check for the wristband. If we see the wristband there, we can check for the name by checking in your notes. The name, the identification of the name, the full name, first name, middle name, and the last name. Then, also the medical record number if it's available. And also for the birth of date if it's written on the ID badge. Okay? Then, after confirming that the patient we are treating right now, we can proceed. Okay? When taking vital signs, we should start with the temperature using the thermometer. Be sure that it's clean. You clean it. After cleaning it, be sure that it's clean. Okay? Throw your garbage. Then, we can start putting it on the axilla. But first, you have to lower or expose the skin of the patient. Okay? Especially if you're checking for the pulse and the respiratory rate, we should know if the patient is abdominal or chest breather. So, if it's abdominal, you can place this one, your hand. First, you have to put the thermometer, placing on the axilla here. Then, just adduct the shoulder inside. Then, this one, the hand should be, if the chest breather, put it here. So you will see the chest rise while palpating for the pulse rate. If not, if the patient is abdominal breather, you should put in the abdomen. Okay? This way. Then while palpating also for the radial pulse while doing the pulse rate. Okay? In this position, you can already start performing your temperature, your pulse, respiratory rate, and the pulse rate at the same time. So after a minute or 2 minutes, you can check everything. Again, clean afterwards. Clean. Be sure you're cleaning it, everything, returning it back, what you have used. After taking the 3 parameters, you can now proceed taking your vital signs. Okay? Be sure that you clean. Since I dropped it, I cleaned it earlier, I should clean it again. Okay? From this, okay, the earpiece, and also for this one, to avoid contamination for the patient, to prevent the spread of the infection. Okay? especially if this patient is a long-term case. Okay? So, when taking blood pressure, be sure that the earpiece should be going like this way, in anteriorly, so that it will fit well on the orientation of our ear. Okay? Then, be sure that you're checking it. You hear something if it's open. And be sure when you put it in the arm, be sure that it should be touching not with your index finger, not with your thumb, because this have another pulse. So you should press like this. And you have to put it on here on the medial side of the arm, this way. Okay? So we should give this one on the side, put it on the side. Be sure that it's already open and clean. Then you can put the cup. Put the cup on. Should be done. Exposing the arm. Okay? Exposing the arm. This cup should be on the middle part. It should be anteriorly positioned this way. Then put it on the middle of this one. Okay? Then hold it with your other hand. Then be sure this is locked. Yeah, lock it. Then pump the cuff. At least we will pump until 140. Then when releasing, you will first hear the carotid cuff sounds. First carotid cuff sound will be the systolic. And when the blood pressure normalizes, that will be your diastolic. Okay? Then, after using everything, we should always clean what we have used. Okay? Before we clean everything, we should first arrange the clothing of the patient, bring back the flat sheet of the patient. Okay? Now, after doing it, we should clean again what we use, always to prevent for the contamination of the patient to infection. Then, including the stethoscope that you use for another individual or another staff that will be using the stethoscope. Okay? Be sure that it's clean and bring back the position. Close it. Okay? Maintain the closing. Then, after that, perform hand hygiene again. Then, after that, you can go out in the room, document everything, and that's all for the vital signs taking. And thank you for watching. Bye!